Preparing to go abroad requires a lot of planning. One of the key things you need to think about is your health. In this module, we will go over what you need to do to stay healthy abroad and be ready in case a health issue arises.
Be ready. This video will test you on a few true-to-life health-related situations or questions that have confronted students in the past. Consider your responses carefully.
For any student going abroad to any location, you need to make an appointment with your doctor. This is a good time for your annual checkup to ensure that you have no new health concerns. During the appointment, make sure to talk about any current and ongoing health conditions and how studying abroad might impact your health. It is important to get your doctor's guidance on how you will manage health conditions you might have while abroad.
Jamie has chronic fatigue syndrome and is preparing to study abroad in China. They have officially approved academic accommodations with ASAC here at AU. They don't think they will need these same accommodations while in China. Does Jamie need to disclose their condition to AU abroad?
We recommend that they do. Even if you think academic or disability-related accommodations are not necessary abroad, it is important to let us know so that we can make sure on-site program staff are aware and see if similar accommodations can be made abroad if the need arises. It is hard to know in advance the challenges you might experience abroad, so better to be prepared. Also, keep in mind that even if you have approved accommodations here at AU, we cannot guarantee the exact same accommodations will be available abroad. Always disclose and discuss with AU Abroad if you think the information is important.
Please speak with your AU Abroad advisors before you go abroad about any health issues or concerns you have. AU Abroad will work with you to identify what site-specific resources are available.
If you have a disability of any kind, it is really important to complete the Disability Accommodation Request Form in your AU Abroad application portal. In addition to disclosing this information to us, you will need to meet with the Academic Support and Access Center to discuss your plan to study abroad and obtain official documentation of your disability. AU Abroad cannot work with on-site staff to determine possible accommodations for you without receiving this information.
Alex is preparing for a semester abroad in Argentina. Can they cancel the health insurance they have here in the U.S. during the time that they're abroad?
We do not recommend it. You will have international health insurance while abroad, but you should also keep your U.S. health insurance. If you have to return to the U.S. for any reason, your international coverage does not necessarily cover you in the United States.
While AU's travel assistance is for worst-case scenarios, you will need primary health insurance for standard medical care, like if you get the flu, twist an ankle, or need to see a doctor. Some countries have universal health care, for example, Australia, Israel, or Italy, and you will be required to purchase their health insurance. Some programs include required health insurance in your program fee, such as DIS, CET, or Amidist. If none of these apply, you must check if your U.S. health insurance will cover you internationally, or if you need to purchase additional insurance or a travel insurance policy while abroad. And of course, you must maintain your U.S. health insurance.
Beyond what you absolutely need, we recommend you consider additional travel insurance. If you do any personal travel independently from your study abroad program, before, after, or even during the semester, the AU Travel Assistance Program does not cover you. You will need your own insurance for those times. Travel insurance can often include things like trip cancellation coverage, personal belongings, like your laptop or reimbursement for lost luggage. This additional insurance is not required, but something you should consider. Lastly, similar to a semester on AU's campus, if you have to withdraw due to unforeseen circumstances and come home early, you could lose a lot of money on tuition for a semester you are unable to complete. AU's tuition insurance helps cover a portion of your tuition in the event that something like this happens. We recommend this insurance for any student going abroad.
Get details about what AU's Travel Assistant Program covers and access the ID card, see quick links for emergencies, and considerations for purchasing additional insurance. Go to the Safety and Health section of our website.
Jordan is preparing to go to Morocco. What do they need to do to ensure they can continue taking their prescription medication while abroad? A. Get a notarized prescription from their doctor to get it filled on site. B. Ask an on-site staff if their prescription is allowed. C. Check the CDC or travel.state.gov websites. Or D. Check with the Moroccan embassy if the medication is allowed.
The correct answer is D. Check with the Moroccan embassy if the medication is allowed. You should always check with your host country's authorities for any rules and regulations about medication.
Are you currently taking any prescription medication or regularly use a specific over-the-counter medicine? If so, you will need to make sure that you have access to them while abroad. The best plan is to bring these with you. Talk to your doctor about getting a supply of medications to last the entire time that you are abroad. Generally speaking, it is not possible to send medications outside the country, so don't plan on it.
When you leave, make sure to pack all medications in their original containers in your carry-on. Also, have a copy of the prescription or letter from your doctor for all prescribed medications.
It is critical that you research the laws and regulations of any country you will be going to, that all your medications are allowed. There are many countries where certain medications available in the U.S. are illegal or highly restricted. If your medications fall into these categories, you will need to work with your doctor to transition to alternative medications prior to going abroad. Sam is heading to India next semester. Where do they find information on what immunizations are needed? A. Their doctor. B. The CDC website. C. travel.state.gov. Or D. A travel clinic.
All of these are great resources, but you will need to do legwork to determine what, if any, immunizations are needed. All countries recommend that you are up to date on routine immunizations, but others may be recommended or required.
The CDC website regularly updates key medical information for countries abroad. This includes recommended or required immunizations, key ways to stay healthy, and any travel health notices. Go to a travel clinic or a doctor familiar with international travel concerns at least 6 weeks before you leave. Keep in mind that some immunizations require a waiting period between injections in a series that can span several months, like hepatitis B. So start on any needed immunizations early. Some countries may require you to provide proof of needed immunizations as part of the visa process or upon arrival. Make sure to get a letter from your doctor including the list of injections you received or have them recorded in an international certificate of vaccination or prophylaxis booklet.